Our spine has 33 bones, which usually work in perfect order, but as we age, that can change. Each year, more than 1 million people are diagnosed with spinal stenosis, making it the #1 reason for spine surgery in people over 60. And now there's an alternative way of treating this condition besides traditional spine surgery. That's where Dr. Ryan Reeves comes in. He's with the Spine Team Texas, and he's here to tell us more. Hello, Dr. Reeves.
Hi, Amy.
Let's demonstrate exactly on your model here what's happening when we're diagnosed with spinal stenosis.
Sure. Spinal stenosis is a condition that causes congestion or narrowing of the central spine. That's this area in through here. These are normal age-related changes that can occur that include redundancy or thickening of the spinal ligaments.
Okay.
There's thickening or bone spurs of the joints, and then loss of the disc heights. All that together can cause congestion or pressure on the spinal nerves.
Okay.
This causes pain in the buttocks, the groin, and the legs. That's typically noted when patients walk for prolonged periods of time, stand for prolonged periods of time, and then typically gets better with sitting and resting. It can be progressively impairing and really affect someone's quality of life.
Okay, obviously anything that gives frequent pain like that certainly does. So what's the traditional treatment for spinal stenosis?
Well, the typical first-line treatment are conservative options of physical therapy, medications, and injections with the intent to calm down inflammation and decrease pain. Over time, if these options fail to provide relief, then more aggressive options are usually chosen, such as surgery. The classic surgical option is an open surgical decompression with lumbar fusion. That requires the placement of spinal rods and screws. Specifically, that can decrease the compression on the nerves, but over time that certainly will restrict someone's mobility.
Okay, so let's talk about the clinical research trial.
Sure. So the Totalis trial is a way to try to bridge that, to provide a minimally invasive option to be able to take off the pressure on the nerves. We provide a sedation to patients to make them drowsy. We use a little bit of local anesthetic just to numb up the skin. We make a small thumbnail size incision that's approximately the size of a dime. We use a tube called a cannula, and we use special instruments, Totalis instruments, through this tube to remove redundant ligament and bone.
So very minimally invasive.
Very minimally invasive.
Yeah, okay. So is it an outpatient procedure?
It is an outpatient procedure. It's all done under x-ray guidance. The procedure usually takes about an hour, and patients go home the same day.
That's all good news. Who qualifies for this research study?
Well, patients that are between the ages of 55 to 85 that have had symptoms due to spinal stenosis and then have lack of response to conservative measures may be candidates for the study.
Okay, so what about the cost of that?
Well, the cost is included if you qualify for the study, and you won't be required to pay additional copays.
Okay, so we can find out more by going to the website to see if we do, in fact, qualify? Okay.
Spine Team Texas is one of 20 centers in America that are actually proceeding with this clinical trial.
Great.
If you're interested, you certainly would be happy to field some calls and direct you appropriately.
All right, I'll get information. Dr. Reeves, thank you so much for being here. Okay, if you suffer from lumbar spinal stenosis and you want to find out if you qualify to participate in that unique study, call Spine Team Texas today, 888-512-3892. Spine Team Texas has locations in South Lake, Rockwall, Fort Worth, Alliance, and Bedford. Contact the nearest location near you, and you can visit this website, spineteamtexas.com. All the information is there. We'll be right back.